morning. I'm Jonah Morrison. I'm the Chief Operating Officer here at HealthPass. First of all, I'd like to thank all of you in the audience for joining us today. And I would also like to thank Chris Maselli from Empire for taking the time to present this valuable information. The title of today's presentation is Details Matter, and we'll take a deeper dive into some of the details surrounding the medical plans that are part of the HealthPass New York PEO offering. In the interest of time and consistent with past webinars, we will not be hosting a Q&A after the presentation. However, should you have any questions, please use the Q&A feature located at the bottom of the screen to enter your question. And we will be sending answers to all questions along with a copy of the presentation to all of those attended in the coming days. I will now be turning things over to Chris Maselli from Empire for the presentation. Chris?
All right. Thank you, Jonah. Appreciate it. And thank you, everyone, for joining. I appreciate you spending a part of your day with me. I know how precious this is to you guys, so I want to use it in the most expedient and beneficial way for you guys. I do have to give an introduction of myself. My name is Chris Maselli. I'm Director of Small Group and PEO here at Empire Blue Cross Blue Shield. Some of you may know me, some of you may not. I am new to the small group side of the business. I grew up and came up through the PEO side of the business as account manager for all of our PEO relationships before kind of marrying and bringing together the small group and PEO environments here for Empire Blue Cross Blue Shield. As my title says, that's my job. So things like this is exactly what I want to be doing. I want to be talking to you about our PEOs and our small group block of business. So with that, I am going to be talking through kind of a brief agenda, kind of a 30-minute agenda. We're going to go through our service area. We're going to go through our selling strategies, the key differentiators. We're going to be going through our high-level view of our networks, how you can actually use those networks, how you can use the power of Empire to bring your clients savings, not only the power of Decision HR and our benefit plan, but the power of Empire built within Decision HR in your benefit plan. So we're going to be speaking about our networks that we have within Decision HR. We're going to be speaking about the plan portfolio that Decision HR has. It is a robust plan portfolio that Patrice and her team put together, that we both put our heads together to kind of have an all-encompassing view of all the price points, all the product designs, and also the key features that run throughout all our products. So with that, in the interest of time, I'll go through our service area and our advantages, and kind of this is really our rules of engagement. The reason I wanted to mention this is because I want to kind of take it at a high level and then really get down deep into the nitty-gritty of the employee, of the employer and employee benefits. So the reason I mention this and the reason this is first is because we're active in 28 counties here in New York. That's something that is not new. But what is the rules of engagement for PEO is that a group not only has to do business in New York, they have to be headquartered within our 28 county service area for them to be eligible for our business plan. So I did want to mention that. We use outside third-party places, Hoover's and Dun & Bradstreet, to verify that. And that is a key difference from our small group marketplace. So I did want to lead off with that and kind of make sure I explain that to you. When it comes to Empire Blue Cross Blue Shield, you know us as the local and national carrier, right? It is the way that 1 in 3 people throughout the whole United States has a Blue Cross Blue Shield ID card in their wallet or on their phone right now. You have access to 95% of the doctors throughout the country, 96% of the hospitals, and 97% of the claims paid. We've been here for over 85 years and have more than 5 million members here in New York specifically that we serve, that we have the opportunity to serve. Now, with those 5 million members, they are on our network trifecta. We have 3 different networks that we have here at Empire Blue Cross Blue Shield. This is the chassis. These are the chassis that all the products that Decision HR has are built upon. I like to start off by explaining this slide, and I get very excited about this is because I like to draw your attention to the right side to the 3 concentric circles, the PPO EPO network, our Blue Access, and our Connection network. Concentric circles. Our PPO EPO network is the crown jewel of our organization. It is the largest breadth of network inside and outside of the United States. Built within that PPO EPO network is our Blue Access network. It is a 97% match of that larger PPO EPO network here in New York. And for that 97% match, what do you get? You get about 8% claim savings and 8%, premium savings on your products by moving to a Blue Access plan design with the same or similar plan design as a PPO EPO network. But within that connection network is our high performance connection network. It is for our 9 downstate counties. In our 9 downstate counties, it is a 70% match. And with that, you get a 15% decrement. The reason why I started you on the upper right-hand side is because of the 3 concentric circles. Our connection network is built inside Blue Access, which is built inside PPO EPO. Connection network, any doctor or provider that's in connection is in Blue Access, and any one that's in Blue Access is in PPO EPO. A simplified way for you to bring value and simplified benefits and communication to your clients. Now we take it a step down from our networks. How do we view and how do we look to see where we are with our providers here in New York? Well, we've got you covered here in New York. Not only is our PPO EPO network the biggest, well, Blue Access is as well. You look at where we compare in the number of providers and the breadth of network. Not only are we able to cast our net out wide with the amount of providers, we're able to bring a lot of those claims in network to provide very efficient care to you and your clients. As we take it a step further and go in a little deeper, these are the key hospital systems that are in each of the 3 networks. If I draw your attention to our PPO EPO network in the middle of the slide, well, what is that? That's 100% of the hospitals there on the PPO EPO network. If we draw your attention to that Blue Access, well, you see every single key participating hospital is there except for Stony Brook. We have to make 2 call outs when we're talking about our Blue Access network. We have to talk about Stony Brook, which is out of network in Blue Access, and Caremount Physicians up in Mid-Hudson. Those are the 2 call outs that we have to make for our Blue Access network. So that really encompasses a lot of that 3%, that 97% match of that Blue Access to PPO EPO network match that we're talking about. And then we have connection over on the right-hand side. Again, that is our 9 downstate counties. And as I said before, you can see all the hospital systems that are in each of the 3 networks, not just in connection. It is there in every single one of our networks. Now we looked at what are the rules of engagement. We looked at what are the key hospital systems, what are our networks. Now we're going to go to the member point of view. We're going to go down to the member point of view so you know that our key differentiators. Well, what is our key differentiator with all 3 of our networks? The key differentiator is that we have Blue Card network throughout every single one of our networks. That is something that you're not going to see in the marketplace. So with PPO, EPO, Blue Access, and Connection, all 3 have Blue Card access. Well, there's 2 different rules of engagement for the eligibility of membership for all 3 of our networks. For PPO, EPO, and Blue Access, this slide's a little busy. I know it's a little busy, but think of it this way. It is anyone, anywhere has access to our PPO, EPO, and Blue Access network. Very, very simple way to explain this slide. The reason why I mention this and the reason why I bring this up is because we do have to make a call out on our connection network. Connection, as we said, is built in our 9 downstate counties, and we want to make sure we codify or explain this in the correct manner. So let's say we'll take 2 examples. Let's say we have a 5-life group headquartered in New York City with employees in New York City and Minnesota. All populations are eligible for this plan. Let's take that same individual group, that 5-life group, now with an employee in New York City, 1 in Albany and 1 in Minnesota. Unfortunately, that 1 in Albany it will not be eligible for that connection network because of what we like to call and what we think of as I think of it as a donut hole in the upper 19 counties in upstate New York. Very, very infrequent. 10% of the business is up there, and even so, of that 10%, most of those members are for clients that are headquartered in there, which would not be eligible for connection anyway. In my 3 years of selling this, I have yet to have 1 person sign up for a connection in the upstate counties. Now, you saw our networks. You saw the power for each individual individual employees. Well, now let's put that together on a spreadsheet. This is the putting the power of Empire to work. What you have in front of you is you have a comparison from small group to the average PEO rate for the comparable product. If you look along those benefit plans, what are you going to notice? Well, you're going to notice that each of the networks, each of the plan designs, each of the copay structures, RX structures are very, very similar. And for that, with the average PEO rate for 100% EPO, we see as 21% savings on a comparable small group plan. So this is a 70 life group headquartered in New York City for 1/1/22. And we see around 21% savings on this specific plan design. So $450,000 in savings for your clients for choosing a comparable plan. Not only that, how do you put the power of our networks to work for you? Well, what you do is you put a comparable Blue Access plan alongside of that PPO EPO plan. So you let the employees choose which actual plan design they want. You could put your contributions based on Blue Access and let them choose. In this example, we chose about 50-50 would go in Blue Access and our PPO EPO. And we show around 26% savings for this specific group. Again, the average savings, right? The average group, the average price that they're paying in a PEO. And for that, right, for basically choosing another network, we're basically excluding Stony Brook out on the east end of Long Island. You're getting 26% savings here with these plan designs that you have within Decision HR. Well, I took you through, what did I take you through? I took you through one specific example. You could say, Chris, that's one example. That's one plan. That's one specific average, right? Well, how does it look overall? Well, not only does, and I think this is a very, very powerful slide. This shows kind of the averages, right? What you're showing is across the book, across the individual product portfolio. Not only is there savings in that, where is that? It's the PPO 15 and the Blue Access 30. You're showing it across all of the products. One of those rows is $200 on a single rate. So think about that. You have that across all of the product designs. So something that we're glad to bring. As we go a little deeper, we're going to go through at a high level our plan portfolio, and then we're going to go at a lower level. We're going to take the high level view of the plan portfolio, then go into, as this presentation mentions, details matter, right? So we're going to go into the details. We're going to show you the details of where the advantages are, and I'm going to show you the places where the disadvantages are too. We want to be transparent where they are. We want to show you everything so that you are fully aware. But there are, as you will see, there are a lot of advantages that I'm very, very happy to show you. Inside of Decision HR's portfolio, there are 13 plans, 6 EPOs, 3 EPO HSAs, 3 PPOs, and 1 PPO HSA. Every single one of our plans, as I've said, and I know I'm beating the horse, but I'm beating the horse to death, but every single one of our plans has Blue Card access throughout the whole United States. They all have access to Sydney, our member mobile application, and I mentioned that, and I'll mention that again at the end when we go through that in detail. We have virtual care options built within that Sydney application, medical text, chat, and video visits. Our pharmacies powered by our own in-house IngenioRx pharmacy vendor, and gym reimbursement and wellness incentives that are built within, and that is another differentiator that we will talk about in detail in a little bit. So what I'm going to do is I'm going to go through these plan options. I'm not going to go through every single detail. I know you don't want me to go through and talk about every single detail, but we're going to talk about our plan options from the least rich to the most rich plan designs. On our EPO HSAs, we have 3 different networks for you at 3 different price points with 2 different deductibles. All of these plan designs are embedded plan designs. So embedded HSAs are not something that you see, and that is another detail. That is something that matters, right? That is you are providing a better benefit plan for your members in an embedded situation. The other thing that I want to mention is I want to mention our formulary, our RX network and RX formulary. All of our plan designs that you see here today is our base RX network, which is our largest RX network. And built within that we have two formularies. Our national formulary, which is on every single one of our PPO, EPO, and Blue Access plan designs, is our open formulary. It's an open formulary with that is our largest choice, with around 96.5, 97% of all FDA approved drugs on it. And it provides access to drugs and therapies that show clinical evidence to improve members' health. Then we have the essential formulary, which is on our connection network. It is a closed formulary and it excludes certain over-the-counter, certain low-cost alternatives. It is the way I like to call it. I like to call it a generic-driven formulary. It includes generic-driven equivalents to have the member hit premium savings for them upfront. Next, we have our PPO HSA at a $3,000 deductible. This again is an embedded plan design with a 150% Medicare out-of-network reimbursement, and again on the national RX formulary. We have 6 EPOs to choose from at all different price points, as you saw on the previous slide. For 3 different networks, from a $0 deductible all the way to a $4,000. Again, those 2 RX formularies that I show there on the bottom, Essential is on our connection and National is on all our PPO, EPO, and Blue Access. And the other thing that I mentioned is our Live Health Online and virtual care options. That is a free to $5 copay for virtual care through Sydney, which we'll go through in a little bit. Next, we have our 3 PPOs here. We have 3 PPO options to choose from at 3 different price points, all with national formulary, virtual care options, and 2, the differentiator here, the 2 with an out-of-network UCR reimbursement. So for those clients that are looking for those clients that are in those high PPO plans, those are perfect to bring over to a PEO arrangement, as these have options that they just don't have in the small group environment. Now, I am going to take a little sip here, so give me a second. Now, I went through these at a high level. What I also wanted to do is I wanted to give you an extremely detailed look at our plan designs and how they compare and the chassis that it's built on. So I'm going to go through a PPO example and an EPO example with you. As you can see, this is a sample small group plan. It is what we see out in the marketplace. And how does that compare to the chassis that Decision HR's plan designs are built on? You'll obviously see the red are ones that we see as negative and green as we see as positive. It's not all green on the Empire PEO side. Again, we wanted to be that trusted person. So we're showing you everything here but there are way more green than there is red. Not only is it co-insurance, deductible, out of pocket, those are to a comparable plan design out in the marketplace. It is out-of-network reimbursement. It's a radiology copay. It's ER copays. It's home health care copays. It's mental health out-of-pocket, partial hospital, allergy, chiro. The big one here is infertility/IVF, right? So everyone has infertility coverage, but in large group, and PEO is built on a large group chassis, it is a 3-cycle max throughout every single one of the Empire PEO plan designs. You have PTOTST, that is a better copay. You have your gym reimbursement, which is a better copay for everyone up to 18. Drug deductible, drug brand, formulate, everything that we see. So it's not only the explicit plan design options, it is the back end copays too that we wanted to show you are better for the member. And then one of the things that we did was wanted to show you the EPO. You'll see pretty much the same type of structure on your EPOs. The only difference really is your ER. Your ER, where in the other one was copay, within your PPO were copays. This is deductible and co-insurance and a copay on the Empire PEO side. Everything else would be the same. So it is not only your plan design, it is the back end plan design and the chassis that each of them are built on that are better and show better for the clients and show better in terms of what we like to call in colloquial terms, benefit relativity. How much is the benefit worth? How much is the value of the plan? The value of the plan on the PEO side is worth more than the small group environment. Another key differentiator here is our Be Active Wellness Incentive, a very, very vast $1,100 in incentives that members can use to stay healthy and keep healthy. I mean, those are the two keys that I want to mention: stay healthy and keep healthy. Because not only are there gym reimbursements to keep people healthy, there's flu shot wellness exams to make sure that members are staying healthy. It's also for members who are chronic, right? Members who are chronic can also participate. They have condition care, they have well-being coach, condition care for participating in a nurse-centric program, well-being coach for participating in one-on-one support to help members lose weight, quit tobacco, any of those type of things. So very good incentives for your members built within every single one of our plans. The next incentive that we really want to mention is our deductible and credit process. So for any group that you bring over, we will credit an in-network and out-of-network deductible expense incurred by the member during the previous incurred during the calendar year. It will be applied to our Empire's in-network or out-of-network limit under Empire. So let's give you an example, right? So let's say you had $1,000 deductible in your previous plan. You spent $500 of that $1,000 deductible. What we'll do is we'll credit that $500 deductible that you spent, and the rollover will be applied to your new Empire's deductible and out-of-pocket. The next thing that I do need to call out is RX deductibles are not creditable. So that's the only thing that is not creditable on your deductible credit process. And also every single plan design is built within the age 26 dependent policy. I would be remiss if I did not mention Empire's dental and vision services that are built within, you have the option to choose should you come to Decision HR. Now, care and compassion for our members and overall health are really at the center for every single thing we do. That's why we're dedicated to simplifying and enhancing the member experience. Not only does Empire have one of the largest dental networks backed by Blue Cross Blue Shield plans nationally, it also is built on the same chassis as our medical plan. So our medical plan talks to our dental plan, talks to our vision plan. And it is one ID card, and it is one source where all doctors can see medical information, dental information, and vision information for every single one of the providers. So a dental provider will have access to medical information through this. What are we able to do with that? We're able to make the healthcare journey of each individual member better. We're able to close gaps in care. We're able to provide more efficient care for the members by doing this as well. So not only is that within dental, not only do we have great network savings, a great network, it's also built within Empire's vision as well. One of the largest national networks with a mix of independent vision providers, national retail locations, and online stores. Over 39,000 doctors and 29,000 locations. And that same story that I just told you, with everything built on one chassis, also goes for Empire Vision. So not only do the dentists view all the claims information, so the ophthalmologist. At the next level, what we're going to do is we're going to go through and we're going to run through some of the key features that run throughout all of our specific plan designs here. What I want to mention is Empire's goal is to really meet members where they are. And I want you to meet the Empire skill for Alexa. Empire is the first health insurance company to have a HIPAA compliant smart speaker application. On any Alexa enabled device, what are we able to do? We're able to meet members where they are and enable them to use technology to find what I would like to call real-time convenient care in really any way they choose it. With Alexa, you're able to ask for an ID card, check an HSA balance, even schedule a call with member services, or even should you choose refill a prescription. I mean, I have Alexa right to my side. My kids love to use it. I had to turn it off to really use this and really tell you about Alexa because there'd just be going on the side. It is a password protected service. I use it to refill prescriptions. My last refill was through Alexa. Very, very easy way to meet members where they are, to have them use healthcare how they want. I want you to meet our new digital platform, Sydney. It is a digital platform designed to deliver what I like to call a smarter, simpler, and more personalized healthcare journey. Sydney is designed to really humanize the member experience, to give everyone a feeling that they have a healthcare ally, someone in their corner to guide them and support them on their journey. It is a new digital platform that integrates all benefits together for whole person care, not only by providing information, but by using information and artificial intelligence to proactively stay healthier and keep members healthier. We like to say it has gaps in care notifications, and it does. And it has findings based on providers, based on quality and cost information. The way I like to explain Sydney is, my Sydney is not the same as your Sydney. Over on the left-hand side is the front screen, is the screen that you're greeted with. So let's say I have diabetes. My front screen, what I'm greeted with when I sign into Sydney, is not going to be the same as yours, because my healthcare journey is not the same as your healthcare journey. The way I go through health insurance and use health insurance is not the same. Yours might show ways to stay healthier. Yours might show ways, hey, you haven't used your gym reimbursement. Where mine's going to show, hey, I see you haven't, have you checked your A1C today? Maybe through claims, we're able to see that you did not go to the doctor, that I did not go to the doctor, excuse me. I did not go to the doctor for my regular checkup. Well, it'll pop up and say, hey, have you been to the doctor? Is it time to get your A1C checked? Ways to keep members healthier and to keep them going forward on their healthcare journey. Not only does it have all those things that a regular app has, it also has a place called Find Care. It has virtual care options built within it at low or no cost. It has a symptom checker that you're able to get member history and really use that to have symptoms checked before you go to the doctor. Not only that, it has virtual care options built within it. A text visit with a virtual care doctor is not a one-time experience, right? You don't just go to the doctor once. Doctors can establish, with a virtual care options, they can establish a long-term care plan and a continue one, leading to greater confidence for our members in care. Like, let's say a member went to a doctor, went to an urgent care center for an injury and needed a prescription refill. They can text the doctor through our app to get that prescription order refilled. Their doctor will have the complete history and can even add to their treatment plan if the member goes back to see their doctor in person. They will see what the virtual care doctor prescribed and recommended. It's all part of our integrated whole person approach to healthcare, instilling greater confidence in our members and able to keep them healthier. And as our goal, meet members where they are. Your employees can save time, right? Well, who doesn't want that? By connecting with a medical doctor through a virtual visit, all from the comfort and privacy of your home, day or night. Within 15 minutes, doctors can assess, diagnose, and treat conditions, and even prescribe medications. There's some very good stories. One of the stories I like to tell about this is, my son woke up one night with a fever. Daddy, well, really, mommy, if we're being really totally honest, mommy, my ear hurts. Was able to see a doctor, and at this time it was built within our Sydney application. Was able to see a doctor in 5 minutes, and they were able to send over a prescription to our pharmacy. So rather than wait the next day, I wouldn't have gone to work, my wife wouldn't have gone to work, my son wouldn't have gone to school. He was able to get medicine and able to be treated, and he's able to cope with the condition much better than waiting the night and just giving him Tylenol. So great options for your members to have them stay healthier and, again, meet them where they are. And the last thing I like to mention about virtual care is it's not only virtual primary care. It's not only for those urgent care visits, for those primary care visits. It's also for mental health visits. And we also have mental health built into, we also have behavioral health services built in through our partner Live Health Online that are there that you're able to see. Mental health, as we know, is a big, it's becoming very prevalent. It's a big topic coming out of COVID. And yay, we're all coming out of COVID, but it's a big topic coming out of COVID. And getting members care when they need it is very, very key in the mental health industry. So many times with a provider, you're waiting for services, you're waiting to get in touch with doctors because they are overloaded. The average wait time to see a psychiatrist or psychologist on our option, the virtual care options, are somewhere around a day to two. So getting members care when they need it, at the time they need it, is the goal to meet members where they are. And one of the last couple things that I want to mention here is our Empire Health Guide. I don't know about you guys. You guys seem very well versed in healthcare, but many consumers of healthcare find it challenging to navigate their health benefits, right? There are so many studies that have found that healthcare literacy is a big problem in the country, with only around, I forget the statistic, but it's around 9–10% only have basic understanding of healthcare terms like deductible, out of pocket. With Empire Health Guide, members are able to they're able to have support from a concierge team to help them navigate their healthcare to, again, meet them where they are. A concierge advocacy customer service model helps your members navigate the healthcare system. Our teams create a simpler experience, answer their questions, advocate for their care to help them get the most of their care and coverage. So they don't have to do what we like to call healthcare homework. They do that all for them. And then the last thing I want to mention before I wrap up here is built inside all your plan designs are your special offers and discounts. You can save money on goods and services such as glasses, fitness membership, vitamins, hearing aids, and weight loss programs. So with that, I turn it over to Jonah, and I want to say thank you for listening to me. Thank you for coming. Thank you for your time. I thank everyone, and I hope to be hearing from you more soon. And thank you, Jonah.
All right, thanks, Chris. That was great. And we're thrilled to have the HealthPass New York PEO, underwritten by Decision HR and Empire, as part of our portfolio of products. In his presentation, you probably noticed that Chris pointed out a lot of differentiators that can make this product appealing to small businesses. And so I also wanted to point out some of the additional aspects of the HealthPass New York PEO, powered by Decision HR, that make this product stand out to your clients, such as Fortune 500 benefits at a portion of the cost, one-on-one payroll support. This means no call centers, regionalized human resources and workers' comp management specialists, and benefits concierge service for members. So on March 30th, we're going to be hosting an additional webinar where Patrice Alvino from Decision HR is going to go into more detail about how these and other differentiators can make the HealthPass New York PEO the right fit for your clients. An invitation with the registration link will be sent out in the next few days, along with a copy of this presentation and the Q&A that I mentioned at the beginning. This concludes our webinar for today, and thank you all again for attending.